Good morning, everyone. I'm Zach Kuntz. I'm the Planning Section Chief for COVID-19 Haywood County Incident Response. Please mute your cell phones and silence your radios. Our incident objectives are to provide for the safety of the citizens, public, and first responders of Haywood County, including the towns of Canton, Clyde, Maggie Valley, Waynesville, and all communities. Establish alternative solutions for triage, testing, and screening that maximizes the impact or minimizes the impact to the existing medical system. Maintain support and assure safe operations of essential local government functions. Develop and share appropriate, clear, relevant, and action-based communications instructions to public, private partners, and the community that they directly and indirectly support our goal. Utilize the policy group composed of county municipal executives, public health, and emergency management for overreaching guidance while closely monitoring and following state and federal recommendations. The Director of Emergency Services shall be the facilitator of this group. Effectively support impacted communities and citizens, especially vulnerable populations affected by our requirements. Maintain adequate records of finances while following accounting practices established by the county government. Monitor and report economical impacts, broadly engage and empower applicable disciplines of the people within Haywood County directed in an effort to accomplish our goal. Situation reports are due by the policy group on Monday, Wednesday, and Friday starting next week. As I spoke there just a second ago, our policy group is displayed for you. This policy group is composed of the Emergency Services Director, the Sheriff, the Health Director, all 40 municipalities, the county manager, along with elected officials. Here's the org chart of how our incident management team is established. I'll now turn it over to the operations section for him to cover his organization section.
Good morning, everyone. My name is Cody Parton, Operations Section Chief for COVID-19 Haywood County, North Carolina Response. I just want to first start off with a quick statement for the Operations Section. We as the Incident Management Team are here to help coordinate a unified response to COVID-19 and provide support to everyone involved, primarily in Haywood County, but also throughout the region. We will accomplish this through preparedness, incident management, and quality medical care. I first want to go over some initial achievements and things that we have accomplished thus far. We have established a comprehensive organizational structure that took several days to bring in. We have finally got that established. We are addressing multiple contingency plans based on the objectives set forth by the policy group. We have established good, effective communications with all the units in the operations section. The situation reports that will be issued from the operations section will be given to the policy group on Monday, Wednesdays, and Fridays. We are obtaining pertinent and crucial information for public releases. If you have any questions currently, please feel free to call 211 to get that information and reserve 911 for emergency use only, please. We're building strong working relationships with all partners involved. The stance we're taking on this is one team, one voice. We have reached out throughout the western region of North Carolina to obtain and see what is and isn't working for our surrounding counties to help us benefit the citizens of Haywood County. Next, I would like to go over the organizational chart for the operations section. I've already introduced myself as the operations section chief. I have two deputy operations section chiefs. One is Bill Miller, the other is Mike Street. They are both currently working on these contingency plans and were unable to be here. My next is my Health and Human Services Branch Director, Ira Dove. Mr. Dove, if you will, please stand. Under Mr. Dove, we have the the Human Services Group, which is led by Teresa Allison and Gayla Jones. Under them, we also have the Nutritional Coordination Task Force led by Lauren Wood. We have a Public Health Education Task Force established by Megan Hauser. The School System Task Force, which is led by Trevor Putnam. We have a VOAD, or the Volunteer Aid Organizations Task Force, led by Celeste Willett, in order to keep all the coordination together there. We're also continuing our Adult and Child Protective Services operation by Lisa Bradley and Pam Montgomery. Also under the Health and Human Services branch, which is led by Mr. Dove, we have the Public Health Group, which is led by Tammy Quinn and Janine Harris. We have a field response task force led by Tina Wells, which is what is currently conducting our field responses that we are currently coordinating. So she is leading the current ones. Testing site task force led by Heidi Lowe, who is doing the current testing that we're able to do and will be modified once we have other plans in place. We also have our private healthcare task force led by Rod Heckelrode, who's making communications with the hospital and other private healthcare facilities. Next up on the organizational chart is our Government Continuance of Operations Group, which is led by Crystal Patterson. Ms. Patterson, will you please stand? She is reaching out to all 4 municipalities in the county in order to get a better grasp on the continuance of operation of the governments all inside of Haywood County, getting out the information to the Emergency Coordination Center for us to be able to release to the public any media or anything like that of the closing of facilities or changes in hours, things of that nature. Next up, we have our Economic Impact Group, which is led by David Francis, who unfortunately is unable to be here due to being in a different meeting. He is reaching out to all 4 municipalities as well as the Tourism Board, getting information on the economic impact that this is affecting all 4 municipalities and the county government as well, and reporting that back for our situation reports. Our law enforcement group supervisor is Don Robertson. Don, if you'll please stand. Don is coordinating with Haywood County Sheriff's Office and the 4 municipality police departments in order to provide a coordinated effort and flawless communication so that we're all operating off the same page. Next up is our fire and medical group supervisor, Daryl Henderson. Mr. Henderson, if you'll please stand. Mr. Henderson is coordinating with our 13 local fire departments, as well as Evergreen Packaging Fire Brigade, North Carolina Forest Service Division in Haywood County Emergency Services, EMS, and the Haywood County Rescue Squad. He's coordinating all of the communication efforts, the resource requests from those individuals, as well as keeping constant guidance sent out to them that's being given to us from the state and federal resources. Now that our org chart's complete here, I want to look at our future obtainable goals for the team. The first one that we're looking at is call center establishment. So we're looking at establishing a call center with a common number that people from the public can call for COVID-19 questions and general other support questions that they might possibly have. Yet again, we're looking at the one team, one voice approach in order to provide the continuous information for this. We're also looking at establishing a social isolation facility for those citizens who don't have any other place to go that need to be isolated after receiving testing. We have a task force established in order to be able to establish that facility. We're also establishing detailed testing and triage plans in order to beef up what the current testing site task force is doing. We're also looking at escalation points in which to determine our levels of response in which we institute these contingency plans. Thank you.
Good morning. I'm Jory Miller, Safety Officer for COVID-19 Haywood Incident. I'm going to be discussing the medical plan, the ICS 206, as well as the safety message, the ICS 208. On the medical plan, the important part is the special medical emergency procedures, which includes, until further notice, to utilize the county wellness clinic, call the office during normal clinic hours to discuss the nature of your symptoms to get authorization to visit the clinic. On the safety message, ICS 208, in order to provide for the safety of the citizens, public, and first responders of Haywood County, and to maintain, support, and ensure safe operations of essential local government functions, we have to utilize a layered approach. Utilization of this layered effect includes infection control, work plan protection, and community mitigation. Key areas to be considered are infection control. Hand washing remains a best practice against spread of the virus. Hand washing should be frequent and done properly by wetting hands, lather, and scrub for 20 seconds, rinse and dry hands. Hand sanitizer use. Sanitizer must have alcohol content of at least 60%. As you're hearing, cover your cough or sneeze into your elbow and wash your hands after. Consider disinfecting telephones and electronics used routinely. Disinfecting wipes work well, especially ones containing Clorox. For a specific list of disinfectants that are effective against COVID-19, you can go to epa.gov. New guidelines suggest that social distancing is the best operating procedure to slow the spread of COVID-19. Social distancing is maintaining a distance of 6 feet from others. Workplace protection: encourage sick employees to stay at home, keep work surfaces and equipment disinfected, use technology for updates and information exchange instead of in-person meetings, utilize personal protective equipment where indicated by utilizing your agency's protocols, increase ventilation in police cruisers and ambulances by operating the system in a non-recirculation mode, and when possible, bringing in as much outdoor air. Early recognition of employees that are ill is important to protecting your entire staff. Community mitigation includes isolation, treatment, voluntary home quarantine of those with confirmed or potential lower respiratory illness, and voluntary closure of non-essential business functions. Consider telework when appropriate. While I have included direction for first response, it is essential for first responders to follow their agency protocols as they are constantly changing. Thank you.
Good afternoon, everyone. I'm Travis Donaldson. I'm your incident management team leader. I'm going to be delivering your logistics briefing as well as the finance section briefing today. Please refer to your 203 for specific contacts within the logistics section. Please run all of your resource requests through your proper channels in your sections and groups, who will then forward those to the logistics section for vetting and fulfillment. The finance section has been in place to track expenses. Please report those through your proper channels in your sections and groups. They will then need to be sent to the finance section. If anybody has any resource requests, please run those through your sections and then on to logistics. Thank you.
Hi, everyone. My name is Lindsay Regner, and I'm the Public Information Officer for the Haywood County Sheriff's Office, as well as the acting PIO for the county right now. My biggest focus is streamlining external communications. Obviously, there's a ton of information that's out there every single day, so we want to make sure we're getting the most up-to-date, accurate, Haywood-specific information released to our citizens. So this also means all media requests to the county related to COVID-19 will come to me. All proactive media releases we send will come from me. This way, we are consistent and accurate in the information we're releasing. I'll stay in regular communication with the subject matter experts as these requests come in. I will update our county website, haywoodcountync.gov, as soon as we have relevant information to update. I've been updating it several times a day at this point. Just to note, any updates made to the coronavirus info tab on the website, those are automatically updated to the Haywood County NC government Facebook page. So that's also a resource for those who are engaged in social media. Again, like I said before, we're keeping these updates as Haywood specific. There's a ton of information happening, and that is also, or a ton of information out there. That's why I'm also working with an assistant PIO at this point. Our goal is to work together to sift through all the newest, latest information and determine what needs to be out there, what hasn't been put out there yet, make sure there are no overlaps, but also gauge what citizens are asking. We do this through looking at social media, just word on the street. What's information people want to know that they haven't had answered yet? So we're going to work together, again, to sift through that information and get those questions answered, whether it be through a traditional media press release or whether it be through newer technology like Facebook Live. Thank you.
Good morning. I'm Wayne Morgan, your incident liaison officer for the COVID-19 incident. It's my responsibility to make sure that the communication flow is open, that we are communicating with all of our agencies and stakeholders from our county. I am that contact number. If you have not been contacted or met with in some way, give me a call. I can connect you with the right people. Again, my name is Wayne Morgan. Contact information is 828-507-2083. Thank you.
Good afternoon again, everyone. I'm Travis Donaldson. I'm your incident management team leader. I would first like to thank everyone on this team, all of our first responders, law enforcement, healthcare providers, public and private partners, as well as the citizens of this amazing county and the great state of North Carolina. We're all in this together, fighting the same fight day in and day out. We will get through this together. We're constantly working to identify shortfalls and gaps as an incident management team. Please help us to do so and contact myself with any issues that you might have. In the end, it'll be impossible to know if we overreacted or did too much, but it'll be quite apparent if we underreacted or did too little. Thank you to everyone for your tireless efforts. Good luck and Godspeed.